Hello and welcome to Caring. December 1st saw the 21st Annual World AIDS Day, an event designed to draw attention to the victims of the disease and raise awareness of the transmission of the HIV virus. It remains a global pandemic, and nowhere more so than in China. Official figures show there are some 700,000 HIV sufferers across the country, yet more than half, it seems, remain unaware that they're even carrying the virus. The Chinese government is slowly waking up to the crisis. The premier took up the mantle and pointedly met with children orphaned by the disease. Beijing has also promised to hand out free condoms in a bid to curb the spreading pandemic. But these are just baby steps and empty promises, according to activists. They argue the overall lack of education and understanding remains firmly entrenched in Chinese society, where the sufferers are discriminated against, ostracised, and often even denied work or schooling because of their health. Adding to the problem, it seems, is the government itself, ever hostile to dissidents or critics, especially when the campaigners are pointing the finger of blame at blood transfusions in the country's primitive state hospitals. Our reporters, Sebastiano Belzic and Henry Morton, travelled to some of the reclusive provinces to hear the sufferers' accounts.
Yuan Hospital in Beijing, one of two in the Chinese capital that can accommodate HIV/AIDS patients. According to the government, a model for the rest of the country, but one that only has 30 beds set aside for sufferers of the disease. 30 beds in a city of 17 million people. This woman agreed to let us film her as long as we didn't reveal her identity. HIV/AIDS is still very much a taboo subject in China, and the stigma attached to sufferers is great. Her story, one of thousands of similar tales across the country.
My husband was selling his blood in 1995, and I got married to him that year. He went to find work in another city in 1996, and we had our first daughter in 1997. She became sick when she was just 6 months old, and despite seeing doctors everywhere, nobody could help, and she died. Our second daughter was born in 1999, and she was ill from the day she was born. But we still had no idea what was going on. She had been infected. I found out I had the disease in 2004. And then the doctors told us that both my daughters had also been infected. My husband died in 2006. There are a lot of families like us in China. I've had a lot of time to think since coming back to hospital, hoping that the government will help me more and help me pay for my expenses and medicine.
The tainted blood scandal originally broke out in the rural province of Henan. The cemeteries in these poor villages are long since full, and bodies are now buried without ceremony in makeshift graves in the fields. The majority of deaths here over the last 15 years have been from AIDS. People sold their blood to local authorities in the 90s, who then resold it to hospitals and laboratories across the country. The blood taken in highly unsanitary and unsafe conditions, a lucrative trade which has led to tens of thousands of deaths. Tsai is living with the virus. Just before she was born, the 7-year-old's mother sold some of her blood and became infected, passing on the disease to her husband and daughter before dying. Since then, they survive alone and without help in this small house in the village of Jumadien.
The medicine costs 30 yuan per month. To be honest, it's not very much. But the government should assume responsibility because it was the one operating the blood stations. And now there are all these people with AIDS.
The drugs these people are using only cost €3 a month. But they receive no help from the government or local authorities. And even if they can afford the medicine, a lack of expertise means they may not even be on the right treatment program.
The medicine I take every night makes me feel sick, and I sweat all day. Some experts came to examine me and told me to change my medication, but the new medicine still makes me feel sick.
There are hundreds of such AIDS villages across China. The government is now controlling blood donations much more carefully, and the officials involved in the scandal were tried and sentenced to death. But HIV continues to spread. Taking a major step to admitting the true scale of the problem, Beijing acknowledged earlier in the year that there had been a 45% increase in people testing positive for HIV in China in 2007. The UN estimates that if HIV infection continues at this rate, there will be more than 10 million carriers of the virus in China by 2010. The rapid spread through sexual transmission, which could be easily avoided by giving people more information and educating them better about the disease.
We estimate that about 700,000 people currently live with the virus in China, and the Chinese government has over the past 5 years developed very strong policies at the national level. Now the big challenge is, of course, how can we translate these very good national policies down to the provincial level, to the counties, to the villages where the people are actually living.
One of the first politicians to break the taboo over HIV/AIDS was Chinese Premier Wen Jiabao in 2003, when he met patients in front of the cameras. 3 years later, the country took measures against discrimination of people infected with the disease. But a recent survey found that 2/3 of the population are scared to even touch someone with HIV. A long way to go before sufferers are no longer shunned by society.
It's very important and useful worldwide to publicize and educate people about the disease. The Chinese government has worked a lot on this. On December 1st, there was World AIDS Day, and every year there will be a lot of celebrities and politicians like Hu Jintao and Wen Jiabao, who will do a lot of things to publicize the problem and tell people not to be scared or look down on people with the disease.
Organisations and individuals who work to improve the lot of HIV/AIDS sufferers are closely watched by Beijing, and it's rare to hear open criticism of the government and its policies. One man who dared to speak up, however, is Hu Jia. The activist, who was awarded the 2008 Sakharov Human Rights Prize by the European Parliament, is now in prison, serving a 3.5-year sentence after giving interviews critical of the government to Western media.
There are many Henan hospitals which have medical corruption cases. So many people who have gone there for surgery or for emergencies have contracted AIDS from blood transfusions. This is a typical example of the government's responsibility. Actually, the blood tragedy in Henan is also mankind's tragedy, because the government should assume responsibility. The problem lies with government departments and medical institutions.
The work of some of China's HIV/AIDS organisations may seem like a drop in the ocean to many. A simple newsletter is distributed to sufferers from this office. A drop perhaps, but at least it's something. These groups are doing the most important thing of all, informing people about the disease and fighting against the systemic failings of the Chinese government. The lack of a tracking system for donated blood, the lack of hospital beds and access to care for sufferers, and the lack of psychological support are three of the main problems that need to be addressed. But the lack of hope is the biggest problem facing people with HIV or AIDS in China, a problem these volunteers and fellow AIDS patients aim to fix.
到了我们这么健康的站在他们面前，本身对他们来说就是一个很好的鼓励。另外对我们自己来说
We are healthy and standing in front of these patients, and it gives them a lot of inspiration. And if we can help them with even a few words or some tiny things, it's inspirational for us too. Our happiness comes from giving, not receiving. By doing these small things, we help ourselves at the same time.
Some exchange words and a hot meal, a comfort all too rare for hundreds of thousands of sufferers. Despite being more open about the situation, HIV/AIDS is still a highly sensitive topic for the Chinese government, and they're reluctant to talk about the extent of the problem, which is growing fast. Infections are spreading across the whole country. 8 out of 10 of those infected are heterosexual, 70% are under 40, and help that sufferers are seeing from the government, next to nothing.
This time in hospital, I got the money from my mother, brother and sister. They don't want to see me suffering at home. My mother worries about me, and my mobile phone died for a few days, so I had to ask my aunt here in Beijing to call my mother in the village. My mother and sister wanted to come and visit, but that would cost a lot with living and travelling expenses. I told them to save that money for my treatment instead.
Last year, her family sold everything to raise the 10,000 euros needed for her treatment, and she's not alone. Of China's 700,000 officially registered sufferers, only 4,000 have access to free treatment. And now there's nothing else left for her to do but survive and pay for her small room. A room that this public hospital continues to charge €3 a day for.
Well, that's it then for this edition of Caring. Join us again very soon. Until then, thank you very much for watching, and bye-bye for now.